As part of the governor's transformation, the Division of Youth Services began an extensive overhaul in November of 2018. Part of that overhaul was assessing the process for determining treatment needs for juveniles.
And today, DYS released some of their initial findings of that change. Our own Jay Burr was at the Capitol today. And Jay, what has been the big change here?
Yeah, guys, the Division of Youth Services has gone about streamlining their process in order to better serve some of the more troubled youth in Arkansas. It's a more robust system, and there's now a team of people assigned to teens to help in that process, which has led to some pretty significant number changes since this has taken place. The Division of Youth Services has changed their approach in treating troubled teens.
It's much more hands-on. The monitoring is much more intense. The planning on the front is much more intense, and we're really focusing on not disrupting treatment.
Juveniles assigned to DYS used to wait months in county-run detention centers for assessment, but now are placed immediately into a DYS facility and are there no longer than 20 days. Director of DYS, Michael Crump, says this has helped streamline treatment.
We would see bottlenecks at the beginning and bottlenecks in the middle and bottlenecks at the end. So really having that treatment team in place and all these clinicians and the increased number of monitoring visits that go on, it allows things to run much more efficiently from the beginning through the end.
The numbers support the changes. Before May of 2019, there were upwards of 73 in county-run detention centers. As of February 3rd of this month, only 6. And the number of kids in the system as a whole is down 33% since May of 2019, when they had 352 in their care, to now just 235. There's also a lot more attention being paid to juveniles after they've been released from DYS.
We want to increase supervision from DYS, a little more response back and involvement with the community-based providers to let us know what's going on, and so then we can reconvene with the clinicians we have on staff now to be able to address kids once they've left our custody.
DYS will start to track recidivism numbers as well to make sure they are following up. But for now, the results have been encouraging.
We're seeing really good results, and I expect those to continue.
DYS also tells me that the court system has also become a lot better in assessing youth that actually need treatment in that residential environment, and that being more proactive at treating the needs of teens rather than basing treatment on the specific charges they get has also helped them be more efficient. Guys.
All right, Jay, thanks very much.